Okay, party people, telling my followers it is 6:30 and I am live on the Derm Couch. I have not done many of these in a long time, actually. Let's see what we've got. All right, we've got a few people coming on. Live on the Derm Couch. I have not done these for quite a while. In fact, it's a little bit of sense memory because the last time I was doing a lot of these, Steve, what's happening, my man? 10 stars to you. Well, I hope Fashion Week went well for you. I haven't done these for a while. There's a little bit of a flashback sense memory to the COVID days when I wasn't feeling too good. But I figured I'd start doing the Derm Couches live again because I want the ability to interact with my audience, get all the questions in, post it the next day. And today is going to be, I'm going to go over some beauty news for a little bit. I first want to acknowledge 9/11. For many of you New Yorkers out there like me, I was born and bred, so it certainly shook our world. And everyone I know from New York, including myself, lost someone very dear to them. My close friend Andy Galkin, who went to Riverdale. I went to Horace Mann. We grew up together. We knew each other for decades. He went down in the towers, and I still think about him every day. And PFRANKMD Heals is involved in a scholarship fund in his name for super motivated young adults who are underrepresented and given opportunities to get scholarships and go to college. And I'm still very close to this family and all of our friends. And I just want to give a shout out and a prayer to Andy Galkin, aka Gogo. I love you and always will. On to beauty news. I'm sure all of you have been watching. I'm sure I'm not the only doctor that you follow or beauty outlet, and I'm sure tons of you have been hearing about Daxxify, or the new botulinum toxin that is out on the market. It is all over. Everyone's showing their little Daxxify boxes and ads from the company and advertising it, but this is not really a new product. It did just get FDA approved. Hey, Auntie Robin. It did just get approved, Daxxify. It is botulinum toxin type A, so it is in the same family of botulinum toxins. It's not new in the sense that we've been waiting for this for about 5 years now. The studies have been done. There were some issues with original FDA approval based on the labs. Hey guys, wow, we're getting a lot of people here. Wave back to all of you. And, I think it's a little bit anticlimactic. I think the social media and the beauty news outlets love to talk about new things. Everything is the next greatest, best, change the game type thing. I'm a pretty positive person, but I love new things, but I always take everything with a grain of salt. There's a lot of direct-to-consumer advertising. There are a lot of people that are aiming to make money off this. My impression from botulinum toxin, or Doxify, is that it will be a valued piece to the armamentarium of neurotoxins. It is not a game changer. Its real angle is that it lasts longer than Botox. When Botox came out, everybody was saying 6 months, if not more. And now I think it's common accepted knowledge that most of the toxins really last about 4, 5 months, some less. Doxify, supposedly in the studies, shows consistent longevity of 6 months or more, which means some people are getting 9 months out of it or longer. But these studies are so difficult because, what's the age of the people? Have they ever done treatments before? There are so many different things involved in studies for cosmetic procedures that, what's going to be relatable in the real world? Unless you tell me the overwhelming majority of people are going to get a minimum of 2 months or more out of their neurotoxin, then I'm not so sure it's going to be a game changer. I have had my hands on this before. I've spoken to people who were in the studies. I'm not yet impressed. What I do know is that it will be significantly more expensive. And the fact that it's going to be more expensive, is it going to be worth it for people to purchase it. I do believe there are some people that are not great responders to neuromodulators, not just Botox, but Xeomin, Dysport, Juvo. I love all of the products out there. There is no best, it's what's best for the person. There are often patients that I am, let me see who's going on here. Nope, I lost people for a second. There are patients that I am doing different neuromodulators on different parts of the face, different parts of the body. I like Dysport for sweating. I like Botox for glabella. I love Xeomin for the forehead because it leaves motion. So I do think Daxxify is going to be a valuable tool. I do not believe it's going to replace the toxins. It will be more expensive to the doctors. It will be more expensive to the consumer, and it better be worth it. And I'm first going to try it on my patients that are not such great responders or find that at 2 or 3 months their product is wearing off. So yeah, I don't mean to pee in anyone's Cheerios, as I was been told by some people I like. Anyway, let's also talk about beauty news about miracle hair growth solutions. In the New York Times, several weeks ago, there was an article about miracle secrets in dermatology, and that is oral minoxidil. Now, just to give a little quick background, oral minoxidil has been around for a long time. It's a blood pressure medicine, and like most things in medicine, one indication is found by accident of using it for another. And minoxidil is a blood pressure pill. It's been used for a long time that they found accidentally grew hair. So what do? I believe it was Johnson & Johnson made topical minoxidil, which got FDA approved as a prescription product. Now, years later, it's over the counter. It is a great tool in the armamentarium in the battle against hair loss for men. For women, hey guys, getting a lot of people joining here. It is a great, I hope you guys are going to start asking some questions soon. It is a great tool, topical minoxidil, but as we know, it doesn't work for everybody. It's not magic. If it did, I'd have hair growing down to my ass, but it does not. And this article in the New York Times was a little overindulgent and gratuitous in it, calling it a secret miracle drug, because I think it would have been used for decades if it really did magic. You can give oral minoxidil at low dose. There is evidence, anecdotal mostly, not so much in studies, because it's too cheap of a product for the pharmaceutical companies to investigate. There is an understanding that at a low dose, not high enough to give problems with your blood pressure, that it can be an effective tool for hair growth. But the question is it worth the side effects? Now, this article in the New York Times made it seem like is 18 years old too young to use Finasteride? No, not if you're losing hair. But, this article made it seem like it's some new secret weapon that not even dermatologists knew about it. We've all known about this. Hair specialists have been prescribing this in addition to Finasteride. But at least with Finasteride, we have documented clinical FDA studies. A lot of the data on minoxidil is anecdotal. And I can tell you from my personal experience, I do not take it. I took Finasteride for 20 years now. I just use Finasteride and minoxidil topical myself because I feel like, why take medicines if I don't need to? Anecdotal evidence suggests that it doesn't really cause an overwhelming amount of growth. It does have some side effects, even at low dose. I do have patients that complained of bloating, a little bit of weight gain, and most importantly, and particularly for women, it causes hair growth on other parts of the body, like the face. And in women, that's not a really worthwhile endeavor. The article did not really talk about the amount of efficacy, did not talk about the side effects. It is not side effect free. It is a blood pressure medicine. You are putting a pill in your body. There are certain people that don't metabolize the topical version and may be worth oral. Listen, it's worth a shot for patients. I'm not saying it can't be a potential tool, but it's unlikely we're going to get any significant data on it because it's a cheap generic drug that drug companies don't have financial interest in. So a lot of the things you're going to hear are anecdotal. So I'm getting all these requests for prescription for minoxidil. I give them the skinny, the pros and cons. I'm willing to talk to them. I'm willing to give them a trial. But please, kids, take it from me. It is not some secret magic potion, and shame on the New York Times. It read more like an Us Weekly article. Anyway, so now we are on to laser resurfacing. I did write down some of the questions that you gave. It is Fraxel season. As I have said in the past, everyone wants to get rid of their summer sins. I wish we could Fraxel every organ of our body, our nervous system, our kidney, our livers. But what's amazing about the skin is its huge regenerative capacity. No other organ other than the gut turns over at such a rapid rate. We get a new set of skin every 30 days. Oh, I just got disconnected. Point is, our skin turns over every 30 days. We could take advantage of that to resurface it and renew. Now, back in the 80s, they started with chemical peels, right? Burn away the old stuff, stimulate the new. It was very... Sorry, guys. Looks like there's a little bit of a connection. Okay, sorry about the connection issue. Okay, so back in the days of chemical peels, they burned everything away. Now we have much or CO2 lasers, erbium lasers. Again, these were all devices like chemical peels that just burnt everything in its path. And they were great, but again, we weren't able to target things specifically. The body has a natural healing capacity. You can't speed it up. So the trick is to try and damage and destroy the things you don't want and preserve the things you do want. So we went from chemical peels, phenol peels, TCA peels, things of that nature. Phenol peels were great, had a lot of side effects, whitening of skin, the waxy visual capacity that people saw. CO2 lasers, erbium lasers, great, fewer side effects, but longer downtime. Only in the advent of fractional laser resurfacing do we have the tools now to really target things specifically without significant downtime. Now, there is always a little no pain, no gain when it does come to laser resurfacing or any type of device to resurface the skin, whether it's for wrinkles, sun damage, or acne scars. The deeper you target in the skin, the longer the recovery. So if you're looking at superficial things, broken capillaries, brown spots, sun damage, only a few days downtime, 3-4 days, max 5 in an older person, a slow healer. Once you're resurfacing the skin down to the superficial dermis, acne scars, the deep dermis, wrinkles, tightening, these are things that take greater downtime. So as you're resurfacing deeper and deeper, there's always more pain, more gain. Okay, and that's true of even the newer technologies. What is great about the newer technologies, before I go into them a little bit more in depth, is that we can target things specifically. We can optimize healing. In many cases, we could use non-ablative technologies, which are ones that do not leave open skin. Hey guys. And you could use makeup during the recovery. So that to me is one of the greatest groundbreaking things we've done. To go deeper and to make significant results in one treatment, though, we still use ablative technologies like the older ones back in the past. Now that they're fractionated, meaning that they're delivered in little pixels rather than just continually burning away, you're microscopically burning and targeting certain areas while not hurting other areas, we can get quicker healing. So it's very rare that anyone should have to go under any resurfacing procedure with more than 7 to 10 days of downtime. Unfortunately, years ago, it was weeks, if not months, before someone was completely healed, and that was a problem. So, what are the resurfacing lasers we're using now? I like the Fraxel name brand. People throw around that word like the word Kleenex. They buy a fractionated laser device and they say, are there any advancements of acne scarring? My daughter was yes. There have been advances, and I'm going to talk about those in a second. Fraxel is like a name brand. It's Ferrari. People call it like Kleenex. I use the Fraxel name brand lasers. There are several of them: Clear and Brilliant, Fraxel Restore, Fraxel Thulium, Fraxel Repair, and they are various degrees of non-ablative, meaning no open skin, quicker downtime, and ablative resurfacing devices like the Fraxel Repair, which is the CO2. So which one is the best? Again, it depends what we're treating. For basic sun damage kids, I stick to the non-ablative, right? Fraxel Thulium, Fraxel Restore. For younger patients with mild issues, we do a series of Clear and Brilliance. But again, as you get older, you need more aggressive stuff. I mean, If you're 55 years old and you've baked in the sun and you're covered in brown spots, 3 Clear and Brilliance is not going to do it. So you have to be open-minded, and I would rather see somebody do something significant or nothing at all, because it's just not worth it. Smoker's lines. This is a perfect example of when we would want to do something ablative, because non-ablative doesn't work as well. Once you get to the deeper fine lines, skin tightening, wrinkles, you need the ablative treatments that do have some downtime because it's an open skin procedure. You really look horrible just for 1 or 2 days, but you're very swollen and you can't really use makeup for up to a week. That's a technology like the Fraxel Repair, which is a CO2 laser. There are a lot of different name brands out on the market. So again, it's important that if you're going to go see a provider, because not everyone's going to see me. Yes, you don't get scabbing from the CO2, by the way. You used to get scabbing from the old CO2s, but you do get a little oozing for 1 or 2 days, and you can't use makeup. So anyway, the point being is, not everyone's going to come see me or someone at PFRANKMD. It is important that when you seek out a laser resurfacing consult, that the provider has more than one device. There is no one device that is going to do everything. It's simple. And a lot of times, if you do have a multifunctional device, it is a jack of all trades, master of none. IPL devices are like this. These are spa devices. They could have uneven treatments. They don't really work for tightening. They could leave stamp marks. They could destroy hair. Although I use IPL technology for the body, I'm not a big fan of it for the face. Also, you have to consider body treatment. Sorry guys, lost you. How much for the blade of CO2? CO2 is going to be a much more expensive procedure. Often I put people to sleep for that. Lasers for scars after breast augmentation. Always treat early with laser breast scars and body scars. At 1 month, get rid of the redness. Start with that. An ounce of prevention is worth a pound of cure with all scars. Start early. There used to be an old adage from plastic surgeons, wait 6 months to a year. That was because they didn't have the technology to do it and want to refer to a laser surgeon. It's just like if you're having problems with construction on a site. Do you wait for the contractors to leave the apartment and call them a year later to bring them back, or do you try and fix the problem while they're still on site? Same thing with scars. After any surgery, 4 to 6 weeks after stitch removal, that's the time to start doing it. So you need fewer treatments and more effective treatments. Anyway, body treatments. It's important with body treatments that you acknowledge that you can't use ablative lasers as much on the body. Maybe for certain scars, but you have to be cautious because the healing of the body takes much longer. There's a higher risk of scarring on the body. Everyone's worried about the face, but the face and the genitals are the 2 best healing places on the body because of the vasculature. Just looking at some questions here. Anyway, it takes longer to heal on the body. When I do a facial resurfacing, non-ablative, 4 days. Chest, 7 to 10. Arms, 2 weeks. Legs for brown spots and sun damage, 3 to 4 weeks. It takes time. And I tend to use things like Fraxel Thulium, BBL Hero. Someone asked me, I have a bunch of these questions, guys, I'm going to answer. Someone asked me about halo laser. Well, could you please tell me, I've developed scar tissue from abdominal etching in my stomach. You know, that's a lipo repair thing. You're not going to fix that with laser resurfacing. Sorry. What about the back? The back, I use BBL Hero. Amazing treatment. And also gets rid of hair and some post-inflammatory pigmentation from acne and stuff really well as well. Anyway, going back to resurfacing, I'm losing my track. Yeah, the body just takes longer, and you have to be cautious of the type of lasers you use. Someone asked me about Halo Laser. Halo Laser is a brand of laser. It's a fractionated resurfacing device that is supposedly an albeit combo of ablative, meaning open skin, and non-ablative lasers, closed skin. The best of both worlds. I've used it. It doesn't go deep enough on either quality to see a big result. I mean, you can get a basic epidermal sun damage resurfacing with the Halo laser, but it is not deep enough for wrinkles or skin tightening. That is my feeling, kids. Sorry, I don't get paid by Fraxel. I just like the name brand. Okay. I'm seeing a bunch of people still joining. I'm going to continue. Hold on, I got a question here. What's the best treatment for tightening Legs and stomach. You know, it's really tough to use resurfacing devices for tightening. On the body, lasers aren't going to really work. They don't penetrate deep enough. Resurfacing devices like energy-delivered microneedling are what we're using for tightening. I'm going to keep talking. Someone asked about microneedling before. Okay, I'm moving this to an area which could be a little better. Let's see if this works. All right, guys. So I'm going to finish this off in an area where there's a little bit better reception here. I'm not sure what's going on. Anyway, microneedling is really what we are using for body tightening because it penetrates deeper. What's nice is that with the microneedling, I can combine it with laser resurfacing, whether it's BBL, whether it's Fraxel. So we use non-ablative lasers, which are safe for the body, and we layer them with deeper microneedling. I like Body Morpheus. Vivace is coming out with a new device. Virtue. There are a lot of great devices that you can combine on the body and the face for deeper resurfacing, which goes to the fact that combination treatments are always going to be the best, right? We talked about this before. What we've been able to do in the last few years is that we've really been able to do the treatments at the same time, because body treatments particularly take few more treatments than you would on the face. One treatment on the face can take 2 or 3 treatments on the body to accomplish the same type of thing. Using non-ablative lasers with microneedling really allow us to target every layer. And as a dermatologic surgeon, I always think about things in terms of layers. What are we actually targeting, right? Is it epidermal? Is it superficial dermal? Is it fat layer? Is it deep dermal? Are we trying to do it all at the same time? With some of the targeted devices we have right now, we could really cause controlled trauma in just about any layer we want. And the advancement of the technologies and the advanced nature of someone who's skilled at doing this, and there are plenty of people out there other than me that are not in your average med spa or general dermatologist office, that can really put together a game plan to combine everything that you need to get the optimal result. Someone's asking about Laser MD or Clear and Brilliant. Well, listen, these are like super basic light tools. You're not going to do anything other than get rid of a little light sun damage. I tend to use those lighter devices, in patients that are in their late 20s, beginners, sort of a gateway to more advanced things. Sometimes I will use them in melasma. Someone's asking about melasma. For melasma, this is always a common question. You cannot be too aggressive. The same lasers that can improve you can also make it worse. So combination treatments, I use 1064 lasers mixed with superficial epidermal lasers. I usually use at-home therapy and oral therapy for melasma. You really need an expert hand. Please do not go to your average dermatologist, plastic surgeon, or med spa for melasma treatments. It has to come from a full, you really have to have a real full game plan on how you're going to accomplish treatments. I'm going to walk back over here. I have to get some of my questions that people gave me. Let's see, guys. Let's see. All right, we're back here. So, laser hair removal and resurfacing, again, a perfect example of how you can combine things. I do perform laser hair removal at the same time that I will do laser resurfacing. Laser hair removal obviously takes several treatments to accomplish what you need to accomplish. But you can combine those treatments. I would make sure that it's done by a professional. Oh, good. First of all, I got to show you guys. This is one of my favorite things in the world. This is a photograph of Prince. This is a black and white Polaroid taken by my friend, amazing artist, photographer, Stephen Klein, and this was given to me as a gift, a one-of-a-kind photograph, Polaroid of Prince. And if any of you are a huge Prince fan, you know that he is not easy to photograph. Anyway, this little piece of evidence there. Darker, people want to know about dark skin recommendations. And again, like with melasma, people with darker skin you have to be very cautious of. You can't use ablative lasers too regularly. On rare occasion you can. Longer wavelengths lasers like Pico and DIAG are better. The trick is you got to kickstand off the mountain when it comes to darker skin types for safety reasons. They do very well. I have a lot of patients of color in my practice, and it's a very specific approach. A lot of people come to me, they've had complications from other devices, other providers, and you really have to create a 6-month game plan to get pigmentation under control for them. Someone's asking about crepey skin. Crepey skin is really going to be addressed with deeper treatments. Treatments like fractional CO2 laser, energy delivered microneedling. Again, this is the deep dermal treatment. You're not going to get improvements in crepey skin with anything with 1 or 2 days of downtime. Same thing, I'm looking here, someone asked about acne, scarring. This is really where I find the energy delivered microneedling has changed the game for us. Really being able to use devices to control not only the depth, but the amount of energy, the distribution of energy. Morpheus 8 is one of them. I happen to prefer Vivace. Vivace is coming out with a newer device. I prefer Vivace because you can really control not only the depth, but how the energy is delivered. Can you do anything from the knees? Of course. Microneedling, biostimulatory injectors, Ellacor, which is, I don't even know if that counts as resurfacing. I'm going to have to do a whole live just on that. Do I still do chemical peels? I do not do chemical peels. I find they're poor man devices. A lot of people who do chemical peels simply don't have the technology, in my opinion. And I just think there are better things where we could be more targeted. But they do work. Are PDO threads worth it? That's a topic in itself. Oh boy. Lauren, you're here. How are you? I'm going to wave back at you. So good to see you. We can't give hugs over the live. Crepey skin under the eyes. I love fractional CO2. It could be done under injectable anesthesia. You do 2 treatments. It's amazing. What's the difference between Pico and Fraxel? Pico is a long wavelength laser, or short, you could get rid of, it's more of a spot cleaner. Look at the Pico laser like a spot cleaner on a window, whereas Fraxel is the Windex. I think that is good. Dr. Jake, all right, keep me looking young from the inside and out. I'm ready for that NADH drip this week. We are talking about Fraxel. What do you do? Face tight Maller bags. I would not do face tight on Maller bags. I think you asked this question. I was going to get to it. I prefer for Maller bags energy delivered micro needling, although there's no real absolute answer for Maller bags. I know a lot of you out there are always asking me about that. When can I go back in the sun after resurfacing? Well, if you have non-ablative resurfacing, you could be back in the sun in 2 weeks. I mean, you could be outdoors with makeup on and sunscreen like the next day. I just don't want you like going to Aruba. But I don't want you going on vacation, getting a Fraxel within 2 weeks of that, a Fraxel thulium. Fraxel repair, which is a CO2, 1 month, okay, because you will have some sun sensitivity. That's the fractional CO2 laser. Which laser is best for sun damage? Fraxel thulium, that machine is running all day right now, kids. And I think that's the most important tool of all the devices I've ever had. I cannot walk anywhere near there without getting disconnected. Anyway, I think Fraxel thulium is the absolute best. I do it once a year myself. It's really good for anybody who has sun damage, and that's anybody above the age of 25. It's done with topical anesthesia. It's 4 days of recovery. It boosts collagen. And again, so much about aging is just getting rid of the bad, not just giving you the new. And I think the thulium and controlling sun damage, healthy skin is youthful skin. It decreases your risk of skin cancer. It evens out the tone of your face. It boosts collagen. I just think Fraxel thulium is the most important tool in my entire practice in 22 years. So I should be getting paid to say that. But anyway, we talked about halo laser, about getting back in the sun, different types of Fraxels we talked about, best for acne scarring, best for neck tightening. Botox not working. Well, you have to think about, let's see, how long do you have to stop aspirin before Fraxel? That's a good question. You don't. okay? Even if you're getting ablative resurfacing, you could be a little oozing or bleeding, but again, you're dealing with downtime with fractional CO2 anyway. You don't have to stop your medicines. You know, when I do fractional CO2, I do put people under propofol with an anesthesiologist. I find it's too uncomfortable for me to do the type of treatment that I want to do for these patients, so I do recommend IV sedation. But for all the other simple non-ablative Fraxels, it's just an hour of topical anesthesia. For deeper treatments, when I'm combining with vascular lasers and pico lasers and microneedling, which is a lot of patients because I'm always trying to accomplish a lot with just 1 4-day downtime, I'll usually give a little ketamine or Valium with topical anesthesia, maybe some laughing gas, but that's really it for pain. You know, when someone says something's painful, a lot of that has to do with the fact that the provider is not providing the right pain control. So it's important, you know, it's not always the laser, right? Laser is just a tool. It's a guitar, as I always say. You know, you have the best guitar, not everyone's going to play it like Eric Clapton. I would like to fancy myself the Eric Clapton of Fraxel. And most importantly, I take pain management very, very seriously. We are an accredited surgical facility at PFRANKMD, and we certainly want to keep people comfortable, because when I keep people comfortable, they have a good experience. When they have a good experience, they get a great result. I do my job. I'm not worn down, and everyone's happy. So when someone says they're in pain, I take it seriously, and no resurfacing treatment should be painful. Certainly not afterwards either. Even fractionated CO2 with Fraxel repair. Resurfacing in modern day should not be painful. And this is a great question. Complications. If you are in pain 24 hours, 48 hours, 72 hours after any resurfacing procedure, call your doctor, okay? Call your doctor. There's a problem. It should not be, you know, painful. Tight, tender, hot, cold, sensitive, normal, okay? Your texture changed 3 months after Morpheus 8. Sounds like you need a different treatment and follow-up. Unless you had a real complication during the progress of the healing, it shouldn't have made it worse, but certainly something to bring up with the provider. I'm getting a lot of questions here, guys. That's great. It has been a half hour. I think I've answered a lot of questions here. We talked, a lot of people love Morpheus 8. There are a lot of other devices out there, guys. I'm excited about Ellacor. I'm excited about new Vivace coming out. I always look at Fraxel resurfacing as the mainstay of improving the health of the skin. All these other devices, you know, but that Fraxel is not going to do everything. And that's where I bring in the other devices. On average, when I resurface the skin, I'll use an average of 3 devices at a time, because I know that, thank you. I'm glad it's informative. I feel like we're covering so much, guys. I'm sorry I can't go into more. But I'm using an average of 3 devices because I think, you know, there's not one that's going to accomplish everything. And it's usually the Fraxel that gives the 4 days of basic downtime. So I like to accomplish that. You know, most people do it on a Thursday. Mondays and Thursdays are the 2 popular days, because if you do it on a Monday, you're good for the weekend. If you do it on a Thursday, you're good for Monday, right? And that's really that. Best device for jowling. That's for another conversation. You know, guys, I've talked about it all. 9/11, Daxxify, minoxidil, oral minoxidil. Unless I see any other final questions, I think we covered it all. I'm sorry that it took me a little time to get the service oriented. I haven't been doing lives for a while. But best Fraxel to start with, thulium. That's it, the Fraxel Dual, okay? How long to see me? I don't know, call me. I'm waiting for you. I'm gonna start doing the Derm Couches live again. What do you think? Someone give me a heart or wave or say something. I think I'm gonna do them live. For those of you that missed it, I am going to archive it and post it onto the feed. And hey, Janet, how are you? And so I will save it. I will post it for you. You can send me some questions. And again, it's great to connect with all of you. And, you know, I'm ready for Monday. It is fall, baby. See you soon.